Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great video for those of you with spondylolisthesis in the lower back. We're going to be going over hamstring stretches, when to include them and when to avoid them. Hope you enjoy. So one of the common questions I get from patients with spondylolisthesis as well as my online clients is whether or not to include hamstring stretches, and that answer is specifically an individualized answer. If you have a spondylolisthesis with a disc herniation that's moved posterior, meaning a posterior backwards bulge or herniated direction of the disc, many times your pain is going to be aggravated with flexion or bending forward. And posterior pelvic tilting, which is tilting the tailbone under to flatten the curve of the back, can actually irritate the disc, versus a spondylolisthesis patient that has most of their pain coming, let's say, from the facet joint or from the various soft tissues that are aggravated by the forward sliding of the vertebra. Just the opposite is going to apply. Those patients or those individuals will benefit from having a decreased curve in the back. By tucking their tailbone under and flattening the curve in the lower back, you're going to relieve the pressure on the back portion of the spine, the facet joints, the back of the disc, and you're going to help support a more stable vertebra, because when the arch increases in the lower back, it helps to drive that spondylolisthesis vertebra forward. So hamstrings attach from the bottom of the pelvis down to our knee. And when the pelvis tilts anteriorly, meaning tailbone up, increasing the arch of the back, the hamstrings are put on a stretch. So if you have a case of disc herniation where your disc nucleus, or the inside of the disc, has moved backwards and pain is aggravated by flexing forward and putting more pressure on that disc, and there is relief with anterior pelvic tilting, meaning that you're raising your tailbone and increasing the arch in the back, you want those hamstrings to be as long as possible, because as the pelvis tilts anteriorly, the bottom of the pelvis lifts up and the hamstring stretches. So you want to support that. You want that increased arch in your back to decrease that flexion or that forward compression on the disc. In this case, hamstring stretches, either standing passive stretches with your legs straight out until you're feeling a pull in the back of the leg, or active hamstring stretches where you're laying on your back, holding your thigh to perpendicular and straightening, are great stretches to include in your routine on a daily basis. In fact, multiple times a day. Conversely, if you're a more classic spondylolisthesis patient or a person that has pain in extension or leaning backwards because that vertebra slipping forward has jammed or has compressed the back of the spine, the facet joints, and the back of the disc, and you find relief with posterior pelvic tilting, meaning that when you hold your tailbone under and flatten the curve in your back, you feel relief. You don't want to include hamstring stretching, because hamstring stretching is going to allow the pelvis to come up. You, on the other hand, want to strengthen your hamstrings. You don't want to lengthen them. You want to shorten them and strengthen them so that your pelvis is more easily tucked under and that curve in the back reduces. So here, exercises like leg curls, either standing with resistance, your heel towards your buttock, or laying down prone, bending the same way, or exercises like straight-legged deadlifts, those are all great for strengthening the hamstring. Now, in the third case, you may be a spondylolisthesis patient that has pain perhaps more on one side due to hip hiking. If your pain is aggravated when you lift one hip upwards or lean to one side more than another, it's very commonly related to a postural problem with spondylolisthesis patients that occurs readily, which is the hip has learned to turn outwards more than the other side. People that walk and stand with one leg out or cross their legs repetitively have developed more of a tightness in their external hip rotators on one side, and that problem of the hip in rotation causes a hip hiking. It also causes a shortening on the lateral or back portion of the hamstrings. Remember, hamstrings have lateral or outside muscles, the biceps femoris, and inside hamstring muscles like the semitendinosus and semimembranosus. So for these types of people where pain is aggravated when the hip is up or leaning to one side more in their back because either disc, facet joints, soft tissues are being compressed on one side, These people want to target the outer or lateral hamstring. And the way we do that is in any type of hamstring stretch, whether it's passive or active, we want to roll that thigh inwards into internal rotation. So your kneecap in this stretch is not facing straight up, but is facing inwards. From this view, if I was laying on my back, I don't want to do a straight stretch here, but I want to do an internal rotation stretch. And when you internally rotate the thigh and straighten, you'll feel that stretch more directed towards the back of the hamstring rather than the inside. That will help to reduce the natural pull on the hip and the leg that comes up, causing the hip hiking, and that'll help to reduce that tendency. So knowing what your unique situation is key to selecting not only hamstring stretches, but any type of stretch for spondylolisthesis pain. That can be done with an analysis on your body. If you don't analyze your body mechanics, your posture, your movement tendencies, you really are flying blind in terms of trying to figure out what exercises are going to be in your best interest. All that information can be done with an analysis on your body. If you have a rehab professional near yourself, that's great. Online consultations with myself is another option for you. Or any of our programs at painfreeandfit.com, any of our ebooks, any of our programs, they all have a self-analysis. So for instance, the Fast Track program for spondylolisthesis that's available at painfreeandfit.com has that analysis as well as a step-by-step program to build you back into fitness, stabilize your spondylolisthesis, get you back into fitness, and support healing in your body. If you like this video on spondylolisthesis and hamstring stretching exercises, feel free to subscribe to our channel. Got a lot of great videos out there. Questions or comments, write in as always. I'll do my best to answer. And I hope this video on hamstring stretching helps you with your spondylolisthesis pain.